My name is Anne Buchea, and I'm a nephrologist and the medical director of the Living Kidney Donor Program at the Ottawa Hospital and University of Ottawa. Thank you for the opportunity to present our project, Patient and Health System Outcomes of a One-Day Living Kidney Donor Evaluation Process. Living donor kidney transplantation is the best treatment of kidney failure to improve quality and length of life. The number of patients living with kidney failure has increased by 35%, while the number of living donor kidney transplants has decreased, with demand for kidneys exceeding supply. Donors find the living donor evaluation process difficult to navigate and long, on average 10 months in Canada. A lengthy donor evaluation process is associated with significant financial and emotional cost to donors, potentially reducing access to living donor transplantation. Healthcare costs can increase as intended recipients remain on dialysis longer. Dialysis is a more expensive therapy with worse quality of life and survival. An expedited one-day donor evaluation process allows candidates to be approved as kidney donors faster. This has been shown to increase living donor kidney transplantation rates and donor satisfaction in Ireland with less dialysis use. However, most Canadian donor programs have not adopted this approach, perhaps because its cost effectiveness is unknown. Our study objectives are to determine whether a one-day evaluation process is cost-effective from the healthcare and societal perspectives, and also whether it results in improved donor satisfaction when compared with the standard evaluation process. To determine costs, we have mapped out our standard donor evaluation process with our donor coordinators to determine each step and the time required to complete each step. Using this data and the existing literature, a cost-effectiveness model will be developed to compare the lifetime costs and health outcomes of the one-day process to the standard process. These health outcomes include the number of donors approved, the number of living donor kidney transplants performed, the number of transplants performed before dialysis is required for the recipient, and the number of remaining patients on dialysis. To evaluate donor satisfaction, we engage kidney donors to create a survey that will be administered to donors approved by both the one-day and standard evaluation processes. Their survey responses will be compared to determine if satisfaction is higher with the one-day process that will start in our program this year. These goals will be achieved with senior scientists in health economics and clinical transplantation research. Our study results will have direct impact on living kidney donor candidates, transplant programs, and policymakers across Canada. We will be the first to identify whether a one-day living kidney donor evaluation process results in less cost to the healthcare system and to donors and improve clinical outcomes. This can lead to widespread adoption of a one-day evaluation process, significant cost savings, and more living kidney donor transplants performed in Canada each year. Thank you.
Hello, my name is Margaret Leary, and I donated a kidney anonymously last year at age 67. My overall experience was extremely positive, and I've been actively promoting the program ever since. One of the drawbacks is the year-long evaluation process. The Ottawa Hospital coordinators did a stellar job in planning the procedures. However, it was stressful and required considerable time investment on my part between work assignments. I firmly believe that a one-day assessment program will improve patient satisfaction, relieve anxiety and stress associated with the prolonged testing. I can see where some patients, especially non-directed donors, would drop out because of the inconvenience of the testing hurdles. For me, each phase of the testing felt like a milestone, worrying whether I passed or not. Being approved as a kidney donor within a few weeks would lead to greater donations and less attrition.